I've been a pharmacist since 97. I have Crohn's disease, and I can tell you something that took me years to fully understand. And your GI doctor is excellent at this thing, managing flares. That's very important. That's incredibly important. I'm not here to dismiss it, but remission, staying in remission, actually healing the gut terrain, preventing the next flare before it starts, that's a completely different skill set and a completely different toolkit. I went to remission on not just on prescription, but from understanding what was happening in my gut that prescription couldn't fix. Today, I'm sharing 5 supplements I use with my Crohn's and colitis clients that almost never come up on a GI appointment. Stay with me because I'm also covering the PharmD notes on drug interactions because supplements are not consequence free. Let's go. I'm Dr. Ina Melamed, functional medicine practitioner, integrative healthcare practitioner, and a pharmacist. I have Crohn's diagnosis and I've been in remission for decades using a root cause approach that changed what conventional medicine doesn't see, doesn't have the time to teach. These 5 supplements do not replace your medications. They work on your gut terrain and they work on things medicine doesn't really go after. Nutritional depletions, mucosal repair, inflammation between flares. If you have questions about your specific situation, the link to work with me one-on-one is in description. Number 1, butyrate. Butyrate is a short-chain fatty acid your gut bacteria produce. It produces it when it's fermenting fiber, and it's the primary fuel source for colonocytes, the cells lining your colon. In IBD, colonocyte energy metabolism is impaired. The colon cells are running on low fuel. Research shows butyrate deficiency is common in Crohn's and colitis patients and is directly linked to increased gut permeability and inflammation. Clinical trials with sodium butyrate in ulcerative colitis showed significant reduction in disease activity scores. PharmD note here. For specific issues, I prefer enteric-coated sodium butyrate for colonic delivery. No significant drug interactions. But if you are on immune system suppressants, monitor as your gut improves. Your medications may need to shift the time of taking it, so work with a practitioner and always ask your doctor. Number 2, L-glutamine. Glutamine is the most abundant amino acid in your body. It's the preferred fuel for enterocytes, the cells lining small intestine. Under chronic gut stress and inflammation, your body burns through it faster than it can produce it. What does it really mean? The cells responsible for maintaining your gut barrier are starving. And starving gut lining is a leaky gut lining. Research shows glutamine depletion contributes directly to increased intestinal permeability or leaky gut. Supplementation helps restore tight junctions integrity, the structural seals between gut cells. PharmD note, take it on empty stomach, dissolve it in cool water, not warm, not hot. Heat degrades the product. Avoid it if there's seizure disorder or severe kidney disease. Number 3, zinc carnosine. And I need you to hear this clearly. This is not the same as just zinc. The zinc carnosine is zinc chelated bonded to dipeptide carnosine. That combination creates a compound that specifically adheres to the gut mucosa and supports repair. You cannot get this effect from a regular zinc supplement. This has been used clinically in Japan for decades. Research shows it reduces gut permeability, supports mucosal healing, reduces intestinal damage from NSAIDs like Motrin or Advil. That last one matters because many IBD clients are managing pain with NSAIDs. PharmD note: take with meals twice daily if possible. Separate from antibiotics by at least 2 hours. Long-term use, add a copper source because zinc competes with copper for absorption. Number 4, curcumin, but only in the right form and only for those that checked with their practitioner about allergies to it, sensitivities to it, and no genomic issues, because there is such a thing who cannot tolerate it. You've heard of turmeric, you may have tried it, and if it didn't do much, here's exactly why. Standard curcumin has bioavailability under 1%. BCM 95 and Meriva formulas that increase absorption roughly 6 to 7 times. That's not a marketing claim. I'm not affiliated with anyone. That's what the pharmacokinetic data shows. The clinical evidence in IBD is genuinely strong. 2006 randomized controlled trial found curcumin added to standardized therapy significantly reduced relapse rates in patients with ulcerative colitis. Multiple studies confirm it worked through NF-κB pathways inhibition, a key inflammatory driver in Crohn's and colitis. PharmD note here: take with fat containing meal only. It's fat soluble. Critical interaction: curcumin potentiates blood thinners, including warfarin and aspirin. If you're on anticoagulant medications, talk to your prescriber right away before adding this, or if you're currently taking it. Number 5, magnesium glycinate. Magnesium deficiency is one of the most common and missed issues in IBD. Crohn's and colitis causes significant magnesium loss through diarrhea, for example, and malabsorption. And standard serum magnesium tests often look normal even when you're actually depleted. The test is that you will see low magnesium driving increased inflammatory markers, poor pain perception, worse sleep, and sluggish motility. Every one of those compounds IBD symptoms clearly, right? Why glycinate? Because the oxide is cheap and causes bloating and largely a laxative. If you're already managing loose stools, that's the last thing you need is more diarrhea. Glycinate is highly bioavailable, gentle, and well tolerated. And here's what I want you to hold on to. Your gut repairs itself during sleep. Improved magnesium almost always improves sleep quality within 1 to 2 weeks. Better sleep means better gut healing. One to the other. This is constantly ignored in IBD care. PharmD note: take in the evening, separate from antibiotics and bisphosphonate compounds by 2 hours. Those for osteoporosis may lower blood pressure very mildly if you're on antihypertensives. Talk to your doctor anyway. Those who take butyrate, L-glutamine, and need support and need to discuss, I'm here for you. And I'll be talking more about immunoglobulins, probiotics, liver support, and other very important supplements in separate videos. These are not replacements for your medications or medical advice. They're what I call terrain support. They work on what medication cannot fix. Used in the right sequence and the right doses, they can meaningfully change what remission actually feels like today. If you want that table, message me exact um, dosing or exact information in my Substack. I have tables and I have so much information. My book is available for free. It's a best-selling book on my website. You can also access all these supplements through my FullScript account. It's a practitioner grade quality, third-party tested. The link is below. And if you want to work through all this with me directly, the link is also below for your specific picture. The consult link is right under this video. If this was useful, helpful, please subscribe, share that little bell, and I will be talking more on functional and integrative medicine, that actually what it looks like in the real world. I will see you at the next video. Please share, subscribe, and maybe think of someone that this could be useful and helpful for. See you next week.